from the Center for Advanced Gynecology, and this is part 2 of a 2-part series on pelvic floor physical therapy, where I sat down with Master Physical Therapist Silvey from the University Physicians Group at the University of Virginia about pelvic health and pelvic physical therapy. The first video talked about what are the signs and symptoms of pelvic floor dysfunction or pain, and what your first visit is like. And the second section focuses on diagnosis, treatment, and tools and resources for pelvic floor dysfunction. And so when you say myofascial release and trigger point release, what does that mean? What does that entail?
That can entail either some sustained pressure to a very tight contracted muscle band. A trigger point is actually an area of a focal hyperirritability in the muscle. We have a lot of trigger points throughout our body, and to address a trigger point, sometimes just putting some sustained pressure on that point for about a minute or two can help that painful focal area relax a little bit. And those tender points can also refer a lot of pain out to other areas. Sometimes we can feel pain in our back and our hips and our abdominal area just from some of those very tight, tender trigger points.
Okay. What's the, what is the expected time for a patient to see improvement?
I think that's a really tricky question. I think that varies from one patient to the next, as well as depending upon the complexity of your problems and your medical issues, as well as chronicity. How long have your complaints been going on for? Generally, I think with my experience, the more consistent and compliant one can be with their home exercise program and with their recommendations, I think the faster the improvement, hopefully. And it's just really hard to specifically say, it's very variable. Some require treatment for much longer than others. Some require months of really working on those soft tissues to change the length and the tenderness and their function, and others can be helped in just a couple of sessions.
So I'd say the typical patients that I tend to send to you, they're generally not quick fixes. This is something I often tell patients who've had years of chronic pelvic pain that we're looking at 6 to 9 months before they really see sustained improvement.
Yes, sometimes, yeah. And sometimes it's really difficult for those patients to realize that there's so many lifestyle changes that have to be made as well. It's not just coming to physical therapy, let the therapist work on you, go home, and hopefully it'll feel better. It's a lot of those changes that have to be incorporated into your life.
Right. The patient has to be a participant. They have to actively engage in the physical therapy and the changes, or they'll be right back in the same spot probably.
Very true. Those muscles have had a painful memory for a long period of time, so changing that length does take some time.
When you talked a little bit about Kegels, and we talked about bladder and bowel function. I think there may be some people believe that this is a condition that only happens in patients who've been pregnant before. Do you see young patients, who've never been sexually active, who have problems with the pelvic floor?
Yes, I have seen patients, male and female patients, who have had pelvic floor related issues of all ages. So I think it really depends upon their risk factors and their causes, some of the things that I've already mentioned. And yes, pregnancy and a vaginal delivery is a major determinant of a pelvic floor related issue, possibly. But I've seen some very stressed grad students who sit for long periods of time who start to develop some symptoms, and it's very overwhelming for them. So yes, it can affect individuals of all ages and backgrounds. Yeah.
patients who have surgery, what do you think is the ideal role if a patient has pelvic floor dysfunction or pain in addition to some other cause, say they have endometriosis? Do you think that those patients should be seen before surgery, after surgery, both? What's the ideal role that physical therapy can play?
I think it can be very helpful for a patient to have some therapy before their surgery, especially if they're planning on having an excision surgery, because not only can it be helpful for the education piece of it, but also for just helping the nervous system as a whole start to calm down a little bit. A lot of times with chronic pain and endometriosis, those patients have been in a state of chronic pain for a really long time, and their systems are quite jacked up. So teaching them to incorporate relaxation strategies, gentle flexibility, all sorts of different techniques that I've already talked about can help them to prepare for that surgery, so that following their surgery, they're better prepared for taking it to the next step.
What is biofeedback, and how do you use that with patients?
So biofeedback therapy is a type of modality that's used for re-educating the pelvic floor muscles. So it's for neuro re-education, neuromuscular re-education. It uses visual and auditory feedback to help train the brain and the body to improve coordination, strength, and endurance of those pelvic floor muscles. That's one part of it. The other part is that you can also train the central nervous system and the muscles to relax a little bit, to teach them to, almost called a down training, to lessen the overactivity of the muscles. So I use either surface electrodes or a vaginal or a rectal probe, depending upon what my goal is. And typically we use it as an adjunct to other therapy methods. I never do just biofeedback. I use it as part of our training with other techniques.
What are some of the other tools that you use to help these patients? So one of the things that comes to mind are dilators. What are dilators, and how do you use them?
So a vaginal dilator is a tool. It can be used to help to desensitize the pelvic floor muscles and to gradually lengthen them. So they come in different sizes, usually varying diameters and varying lengths, and we start using them in the clinic for specifically pain with sexual functioning. And over time, a woman can progress through different sizes of the dilators at her own speed, and gradually progress to being able to tolerate intercourse a bit better.
Lauren, thank you so much. This has been, I think, educational for a lot of our patients. And if you need more information, you can check out our website.